Hello, friends. I'm Dr. Dilip Rajpal. I'm a consultant laser varicose vein surgeon. I'm a consultant in Apollo Spectra Hospital, Chembur. I practice in the city of Mumbai. So today we'll be discussing on the awareness of varicose veins. So first of all, what is exactly varicose vein? So varicose veins is the veins in the leg when it becomes elongated, tortuous, or increase in size. Many patients present it as small blebs in the small nodules. They say that they have nodules in the leg. So that is varicose veins. The varicose vein is typically visualized in people who are standing. Those people whose job is concerned prolonged standing. So basically, anything in this universe comes from above onwards because of gravity. But our body is the only place where actually blood is going against gravity. So those people whose job is considered prolonged standing, when the blood is going from below upward, some will get disease, and because of which a person can develop varicose vein. So now, why is it important to take a note of it? Well, first of all, before coming to the what are the causes of varicose vein? So causes wise, those people whose job is considered prolonged standing or sitting, prolonged it is might be more specific, prolonged immobile sitting or standing in one particular place. So we see in those people, like typically in those people who are in a police job or those security person or bus conductor. We as surgeon also, because we stand for a longer time, we are also prone for varicose veins. Now, in today's day, we see more and more grocery shop owners and even the shop owners, because they sit in one cramped place for a long time. Because which there because you are sitting in one fixed place for a long time, that's why the muscle pumping doesn't happen, and because which there is more stasis, and that leads to varicose veins. So apart from this, of course, other than that, it is age wise. If you see, the incidence of varicose vein increases with age, because when the age increases, the skin becomes more lax. So the support to the veins gets disrupted, and because the veins become tortuous, and because it becomes tortuous, the valvular arrangement deranges, and the person can develop varicose vein. The incidence is more common in females as compared to males. More so, it is hormone related and also because of pregnancy related. Pregnancy, one is because of the hormones. Progesterone increases the veins wall and decreases the contractibility. Apart from that, of course, it is the fetus in the bachu in the abdomen what actually compresses on the main vein. So these also causes varicose vein. Obesity, one of the major causes of varicose vein. So any person presents with high weight, this thing high BMI, we always recommend them to decrease their weight, because obesity again will because more fat will provide less support to the vein, and that's how the tortuosity happens. Hypertension, blood pressure, that increases the venous tone, increase the venous pressure. That is also supposed to increase the incidence of varicose vein. Now, many people keep on asking us, meaning, what is whether it is a familial disease. Yes, it is a familial disease. In fact, in twin studies, they have noted that in identical twins, the incidence is almost 75%, and in not identical twins, it is almost 55 plus percent. And if one of the parent is suffering from varicose vein, then the incidence in a girl child will be almost 62%, and in female male child, it is going to be almost 25%. And if both the parents are suffering, then the incidence is almost 90%. So if both the parents are suffering, then the 90% of the children, there is a possibility that they will have varicose vein. So definitely there is a very strong family history. In fact, many a times we see, because this family history, this thing is there. So people see that they are having varicose vein in their families because they are having in their relatives and uncles, and they themselves are carrying varicose vein from very young age. So in fact, we see that we have noticed over the period of time that these are the patients who actually neglect the disease. In fact, these are the patients who actually present very late, because they think that it is a congenital, it is a family disease. So everyone in the family has it. So I don't have any problem to do. In fact, these patients present with very bad ulcers, wounds, and everything of that sort. So in fact, we are doing these awareness programs. We are doing this sort of webinars, and we are doing a lot of camps to promote awareness. So we want to diagnose, at least we want to put it in everyone's brain that this is a disease and this is not a normal lifestyle the problem. This is an actual disease which can progress to a very morbid condition. Now, coming to the symptomatology, what patient actually presents with. So initially, the patient will present with varicose veins. So vein meaning the veins are visible. So at this stage, of course, patients neglect that. But slowly, what happens, because because there is high pressure in the veins, the patient starts complaining of some pain in the legs. Now, this pain is not like any other bony pain. It is typically like any joint. It is like heaviness in the legs. So, what happens when a person lies down in the bed in the night? So, morning patient will feel very comfortable because the pressure in the veins decreases. Now, as the day goes on, as the patient moves around and does all his normal activities, the pressure in the vein becomes severe high. So in females, typically we see at 1 o'clock, 2 o'clock, or in the evening time, 8 o'clock, 9 o'clock, and males in typically in the evening time once they are free. So because they are completely moving around, the pressure in the vein increases so much that it causes severe pain. This pain is not like any orthopedic pain, any bony pain. It is typically like heaviness in the legs. A person has a feeling that there is something is tied to the legs or some heaviness in the legs. So a person will have a feeling that someone should do massaging or something like that. Slowly, the pressure in the vein becomes so high, the vein white blood actually oozes, or plasma actually oozes out of the vein. So you start noticing some swelling in the legs. Then even the RBC come out. So hemoglobin deposition is there. So you start noticing some blackening in the leg. Now, at this stage, there is a lot of inflammatory changes happening, and inflammatory mediators are released. A person then has a tendency to itch, and once that happens, patient scratches, and because of which a person can develop wounds, ulcers. Now, these ulcers are not like any other normal ulcers. So what happens? This leg is already a swollen leg, and now there's a cut in the leg or there's a wound. So all that swelling or what that water retention was there in the leg that oozes out from the wound. So in fact, these patients will present with very high oozing wounds. So they have a lot of complaints. The leg wounds pour like a tap. So that morbidities condition. So these are the presentations. So patient will present with varicose vein. They will present with pain, swelling, some blackening in the legs. They will present with wounds. So these are some of the stages of the varicose vein. Now coming to what is the diagnostic wise, the best way to diagnose one is clinical examination. You need to consult a venous doctor or varicose vein specialist to diagnose whether it is a varicose vein and what is the stage of the varicose vein. So here meaning again I'll go back basically as long as in our language as long as the veins are visible, that is still stage 1 or stage 2, then we can tell patient, okay, you can wait. But once you start noticing some swelling is happening, discoloration is there, blackening is there, wounds are happening, then it is an alarming sign. That means now you need to do urgent this thing basis, you need to do some surgical intervention. So for diagnosis of exact which all valves are diseased and everything, we do Doppler study. Doppler study, what is called a venous Doppler. This venous Doppler is nothing but it is a sonography of the vein is called Doppler. So in Doppler study, we come to know which all valves are diseased, and accordingly, this complete treatment is Doppler guided. So in according to that, we decide whether a person will go for any medical treatment or any injection foam sclerotherapy treatment or any surgical laser treatment. Coming to the treatment options, what are available? So, first of all, most important thing, it is not necessary. There no varicose in an emergency. You know, varicose, as I told you, the most important problem is that there is high pressure in the vein, which is responsible for the pain. High pressure responsible for swelling. High pressure in the vein is responsible for discoloration. High pressure responsible for wounds. So, most important treatment for varicose vein is keeping the leg elevated. So, once you keep a leg elevated, what happens? The pressure in the vein decreases. So once the pressure decreases, all the swelling, pain, and everything will subside. But that you cannot do throughout the day. So what you can do throughout the day is wearing elastic stockings. So in today's good medical grade elastic stockings are available. Class 2 stockings, what we call it. And these class 2 stockings are give a pressure of almost 20 to 30 millimeters tight. So in fact, once you wear the stocking, it does take almost 8 to 10 minutes to wear the stocking and to remove the stockings. So once you wear the stockings, a person may feel uncomfortable for a day or two, but once you wear that, then all that swelling decreases. So once the swelling decreases, a patient feel very comfortable. He will have a feeling that there is no pain. So there is all the swelling decreases, the pain will subside. But more important than that is the grading or staging of the disease. What do you call a C classification? As I just told you, varicose vein, then swelling, then discoloration. So all this grading will not increase further. So many patients complain was that they have been wearing stockings for a very long time, for 2 years, 3 years, but their varicose is not able. So those stocking is not going to heal the wounds or it is not going to treat the varicose vein. But what happens once you wear the stockings, then the automatically staging will remain constant. Where whatever stage you are there, that will remain. It will not progress to a next stage. So you can definitely buy time. So as I told you, no varicose in an emergency. However, it is important once you start noticing swelling, discoloration, very important to do some treatment, because once you do the treatment, then the disease will not grow and you'll not reach. Our final aim is that you should not reach a stage of morbid venous ulcers. So treatment wise, I told you one is taking some medical medicines you need to take and leg elevation, and third is stocking. That is the most important primary treatment. Coming to surgical intervention, now this surgical intervention is completely dependent on the Doppler report. So in Doppler report, if at all you think the size of the perforator is one is major valves which are there, saphenophymal, saphenopopter, if those are diseased, or the major ankle perforators are very big in size, like more than 3 millimeters. So then we offer them patient laser intervention. So what we do is laser intervention on the ablation of the varicose veins. However, if the size of the perforator is very minute, that is minute means less than 3 millimeter, then many times we can go with a simple injection treatment, what is called a foam sclerotherapy. Now, this foam sclerotherapy, in foam sclerotherapy, we use some sclerosin, some medicine. Basically, it is an irritant which will cause a reaction, injury to the internal wall of the blood vessels, and thereby causing blockage of these veins. So it's a OPD procedure, daycare procedure. There is no pain, there is no suffering. Patient can directly go home immediately after the procedure. There is nothing, no hospitalization also required. But it is not that patient can decide whether I want to go for foam sclerotherapy or laser. So foam sclerotherapy has its own indication and laser has its own indication. So as I told you, if at all the major veins are diseased, then many times we need to do laser treatment. Now, what exactly laser treatment will? A lot of patients get confused. What exactly laser treatment? So basically, this what we do is complete surgery is done Doppler guided. That is the most important. Many we have been noticing that more and more awareness is increasing, but at the same time patients are meaning the not many people are doing Doppler guided. So I will insist that all the surgeries should be done Doppler guided. So in Doppler guided, what we do is we actually puncture the vein. Inside the vein, inside the hole of that needle, we put in a laser fiber, and that complete surgery is done with that needle. So what happens is we don't make any cuts, no stitches are there. So patient is we doing. In fact, most of the surgery we are doing under local anesthesia, meaning after surgery, patient can directly walk to his own bed also. So this particular surgery, there is no morbidity, there is no main suffering. In fact, in 4 hours time, we usually discharge the patient also, unless it is from medical reason where we need to hospitalize many of these patients for 24 hours. But otherwise, many times we can discharge a patient in 4 hours as a daycare procedure. Also, if you are not, if you are doing purely under local anesthesia. Now, it is very important to see to it that we some intervention is required. More and more newer treatment options are nowadays available. Like apart from laser, radio frequency, many patients keep on asking us what is radio frequency, what is SMOCA, what is glue. So more and more newer approaches are being followed. But laser is a very standard this thing where we use diode laser. We are using a 1470 laser, so it causes very less pain and less morbidity, because the tissue burn is very little, so the morbidity is very less. Patient can resume his jobs and everything within 24 hours. In fact, it is we call it a daycare procedure. So I will take opportunity to discuss here what is glue treatment. Now, more and more awareness is going, and patients are asking for glue also. Glue treatment is also one of the good treatments where instead of a laser, what we are doing is we inject some glue into the vein. But the thing is, it is a very new procedure, not very hundred. Not we don't have still we don't have 100% results or statistics has been found out. That is one. Secondly, what happens in our typically in our Indian scenario, our patients present very late. Our patients are not like abroad patients where the presentation is early or more so it is for cosmetic reason. So here we are operating more so for a proper disease, like patient usually present with blackening and wounds and everything. So most of our vein presentation very late. So what happens when they late presentation? Well, the veins are grossly dilated. They are, I mean, they come patients come with a vein size of almost 9 millimeters, 10 millimeters also. when the routine size of the vein is usually 3 or 4 millimeters. So in abroad, when they are doing glue, the size of the vein is hardly 4 or 5 millimeters. So they just put the glue inside the vein and the vein gets blocked. But here in our Indian scenario, the size of the vein is almost more than a centimeter, 9 to 10 millimeters. So when you're putting injection glue, so what happens? In fact, that can have a foreign body effect. So many patients do complain of something foreign body, something is there, some because that glue can have a rod-like effect, or the patient will have a feeling that something is stuck inside. So these some of the things what you notice. But most important thing, it's a very new study. So we don't have 100% statistics as of now. That's why we are still stuck to old school of thoughts, or we prefer laser. Well, a laser is very standard and age-old surgery, and we having good awareness, good statistics, very good results we are having. More so in venous ulcers, we are having excellent results. So another advantage of laser is we can take care of all the small perforators, which are small valves, which are near the ankle also. In glue, it is on the main valves, which is usually taken care of. So these are some of the things about varicose veins. Um, this is basically awareness program, so I will take it to the opportunity more so to see to it that a person, at least the presentation, they should consult the doctor at the earliest as much as possible. And wearing, at least it is not necessary to, there is no varicose in emergency. At least minimum stockings if at all you wear, then also you can keep the disease at least in control. So Doppler is again the most important investigation, because in the investigation we can find out what is the stage and what is the grade you are having. Accordingly, we can take a call. So I'm complete here. So if at all further question, I'll be very happy to answer. So I'll take this opportunity to say that I'm practicing in Apollo Spectra Hospital, Chembur, and we are managing all the laser treatments and the local anesthesia as a daycare procedure.
Uh, Great session, sir. So most of our viewers has raised few questions on
Yeah,
this.
yeah,
So I would like to ask you few queries which the people have raised.
yeah.
So first, uh, we received that can varicose veins burst?
Yes, if at all, it is not usually burst, but what happens is, if at all it is a grade 1 medical, like a venous telangiectasia or reticular vein, then what patient perceive it as spider veins. So if spider veins are there, and sometimes they puncture the skin, actually they pop out of the vein. So what happens initial stages, if you see this vein, this will seem as if it is green in color, because it's four story down: skin, then subcute, then fascia, then vein. But here, what happens? It actually punctures the skin and the skin. So in these veins, if you start noticing some blackish spots in these veins, then there's a high possibility that that can rupture. More so during scratching, and we typically see in the middle of night when the patient is sleeping. So he scratches one leg with the other, and then that rupture. That is one. Or during bathing, so if he's using loofah or something, then that can rupture.
Okay. So I believe that the viewer got his answer. And another question we have, that what happens if varicose veins are left untreated?
So if at all the varicose veins are left untreated and if the size is very big, then that is because there is a very poor circulation, because these veins, there is lot of stasis and blood remains inside. There is a high possibility that a person can develop a thrombus, blood clot inside these veins. Now, if at all the blood clot forms, then it becomes slightly dangerous. Now, the blood is always liquid, and if at all it becomes a clot, and if this clot dislodges, then it will be something like an atom bomb. It can go and block any of the major blood vessels. That can be serious life-threatening complication like pulmonary embolism or something like that. So it is a very important thing to treat it, or at least treat it not necessarily surgical, as I told you. At least wearing minimum stockings. So even if you wear stocking, all the veins will remain compressed. So disease will at least remain controlled, and this complication will further decrease.
Okay. One of our viewer has asked that can drinking water help varicose vein?
I'm not very sure about this, but I don't think it is going to help much.
Okay, okay. So the session is very interacting. So I believe I'm getting a few. Oh, one sec. Yes, we have few more questions. That can varicose veins affect your heart?
Yeah, so I just told you, meaning if doesn't affect the heart, but as I told you, if at all the blood gets clotted and if it dislodges, then definitely person can this can go and block any of the vessel. More so, it affects the lungs actually, cause pulmonary embolism, but it can actually affect any of those. So it can definitely be a very serious and lethal complication.
Okay, can varicose veins go away naturally?
No, it will not this thing. In fact, many Ayurvedic people they do leech treatment and everything. But I just want to convey that it is a valvular disease. Supposing your tap is spoiled, so by doing anything, is that tap going to get repaired on its own? So we need to go physically down there and block that particular vein. Anyhow, maybe with simple stockings or laser or injection foam sclerotherapy, but some treatment has to be done. So automatically, it is not going to subside.
Okay. One more viewer had raised a question like, are varicose veins sign of a blood clot?
Yeah, that is different. Meaning, 80% of the varicose vein is because of the reflux disease. There are two causes of varicose. One is reflux disease, which we can treat with laser and foam and whatever we discuss as of now. Second is it can be a disease because of obstruction. So sometimes if the main vessels are already obstructed, what is called as deep vein thrombosis. So because the deep veins are compressed or blocked, the all the blood can go to the superficial vein. So this patient can develop varicose vein. So in these patients, it is called as post thrombotic syndrome. If at all that happens, then we are very this thing when then these patients cannot even be operated. In fact, for these patients, stocking is the lifeline. So in these patients, we need to again Doppler will be a guide to diagnose, and we need to give some blood thinner medicines to dissolve that clot. And third is stockings will be very important to prevent complication of varicose because these patients will not be able to operate also. We usually wait for 5 to 7 years. If at all the blood is normal, if the Dopplers are normal, after 5 years also, then we can operate. But normally we try to avoid as much as possible.
One more question. I believe that you have addressed this question, but still viewer has raised that what is the main cause of varicose veins?
Prolonged immobile standing or prolonged immobile sitting in one particular place. So those people whose job is concerned prolonged standing or sitting on one particular, in those patients we recommend to wear at least minimum class one stocking. Class even is for normal people. Like I don't have very good, but I also wear stockings. So the day I think my surgery, I have a big list of surgeries to be done. I wear stocking beforehand. So this class one is for normal people, those people who are not having very good. So the pressure of the vein is the stocking is hardly 10 to 20 millimeters. Well, once you wear the stocking, the veins will remain empty and the problem will not happen. So the most important thing, prolonged immobile cell. So those people, as I just told you, security guard, nurses, doctors, or conductors, they should wear class one stocking to be. And class one is something like a socks. If you just buy two pairs of socks, these stocking, then you are done.
Okay, we are getting few more questions that like, are there foods to avoid if someone has varicose veins?
No, food is not directly related, but indirectly related in the sense you need to see to it that your obesity, if you're obesity, then this thing should be avoided. Food will not directly affect varicose, but if at all food which causes obesity that is taken care of, then it will be.
Okay, one of our viewer has asked an interesting question that how do you sleep better with varicose vein? Is there any style of sleeping?
No, I don't think so. So if at all someone is diagnosed varicose vein, yeah, definitely we'll recommend them to keep legs slightly elevated, pillow also that above the level of the heart, but otherwise nothing specific. Anyway, when you lie down, all the pressure in the vein anyway decreases. So simple lying down itself will decrease the pressure in the vein, but keeping leg elevated will further help if at all you are noticing some swelling also.
Okay. So I believe that today's we are getting an most of the doubts been cleared. Thank you so much, sir, for addressing all the questions.
Thank you. I'll take this opportunity to thank this Apollo Spectra Hospital for giving us an opportunity and also spreading this awareness about varicose veins. So here, our main context is to let people know that it is a disease and you need to take care of it. As I told, I'll keep on stressing again. Minimum no varicose in emergency. Minimum stockings also if you wear, then the disease will at least remain under control. Thank you.